We all know someone who has a pacemaker or a defibrillator. Maybe they have a heartbeat that's too slow or it's irregular. You know, when our hearts struggle to beat normally, doctors can implant these amazing electronic devices to set that beat for us. These life-saving implants, they're called cardiac implantable electronic devices, or CIEDs for short. And each year, 1 million of us receives a CIED. And that number is only growing due to our planet's aging population and aging hearts. These days, medical technology is so remarkable that cardiologists can implant a CIED minimally invasively. It's a procedure that can transform your life from being a daily struggle to pretty much being back to normal within just a few weeks, and it's pretty amazing. But here's the thing. In the first 3 years after getting a CIED placed, 1 in 20 patients end up getting an infection. And data shows that that rate is going up the longer a device is in place. Sometimes you might get an infection right at the generator site. It's a pocket infection. But sometimes you get an unrelated bacterial infection somewhere else in your body. Maybe you cut your toe, or maybe you got a pneumonia. And when that happens, the bacteria, they can travel through your bloodstream, and they often attach themselves to the leads of your cardiac device. Not on the chest wall where you can feel the device, but instead along the internal leads of the device, inside your veins and your heart. And it can be life-threatening. Left untreated, device infection, lead infection, it can occasionally result in endocarditis, or even death. These internal lead infections, they can be really hard for your doctor to diagnose, and that is exactly what happened to Alec. He had a pacemaker, and one day he got a chest infection. He started to feel real sick. At first his doctor gave him antibiotics, but that infection, it returned. And that's because infections on these CIED leads, they form what we call a resistant biofilm. So antibiotic treatment alone, it doesn't always work. Those bacteria, they're sticky and they're resilient. For Alec, like so many others, it meant that even with antibiotics, his infection didn't get fully cleared. In fact, studies show that the best way to completely treat that infection is to remove the entire CIED with its leads. Take them out so your body can clear the infection. But for the past several decades, that's been easier said than done. Because you see, these leads, like any implanted device, after they sit for years inside of your body, they get scarred in. Your body creates scar tissue to hold on to that implant. And for CIEDs, their leads get firmly attached to the veins like the superior vena cava. It's the massive vein that returns blood back to your heart's right atrium. So how do we extract the lead that's scarred in? Firmly attached to a delicate vein. In the old days, this would have required surgery, or even aggressively pulling on that lead and hoping that the vein doesn't tear. But now there's a better way, a safer way, a minimally invasive way. And Alec, he had a forward-thinking doctor who knew about this data, who knew that he needed to remove the CIED to treat the infection. And he knew about the new technology enabling this. Using the power of light instead of scalpels, we can now free up that infected lead from the scar tissue around it, with remarkable precision, using image-guided therapy and tools like this. It's called the Glide Light laser sheath, and physicians can thread it through your vessels to remove the infected lead quickly, safely, and minimally invasively, all through a small incision. And it works with the Philips laser system. Studies show that lead extraction, it's not only effective in eliminating the infection, but it's also very safe. And guess what? Data also shows it's less expensive for healthcare services. And for patients like Alec, most importantly, it can be literally life-saving. Alec was back to his normal self within weeks, spotting infected CIED leads, removing devices quickly and safely, fighting infection in a heartbeat, and getting more cardiac patients back to living the lives they love. And now you're in the know.